Immune functions in pregnant women affect schizophrenia. Hey guys, my name is Marne Martin, and I'm a graduating senior psychology pre-med major at Hampton University. And this is my research proposal. Let's get started. Okay, so our objectives. Our objectives and overview, we're going to first start with the background on schizophrenia. Then we're going to get into our research proposal, methods and materials, limitations and future research, and lastly, our references. So, what is schizophrenia? Schizophrenia is a serious mental disorder that inhibits a person from thinking clearly. It affects less than 1% of the U.S. population. It can make a person delusional and damage their mental state if it's not treated properly. Schizophrenia is also defined as a neurodevelopmental disorder that affects children and adolescents, but a lot of the time, the symptoms do not show up until early adulthood. It also affects the cognitive and emotional functions of a person. Some symptoms of schizophrenia: positive symptoms are hallucinations, paranoia, exaggerated or distorted perceptions, beliefs, and behaviors. Negative symptoms would be a loss or a decrease in the ability to initiate plans, speak, express emotions, or find pleasure. And then cognitive symptoms will be problems with attention, concentration, memory, and declining educational performance. So my research question is, can strategies to enhance immune functions in expecting mothers prevent schizophrenia? It is hypothesized that if a mother does not receive proper prenatal care, prenatal vitamins, as well as proper care when dealing with infectious diseases, then there's a possibility of her child becoming schizophrenic at or after age 12. So a little background knowledge from my literature review. Pregnant women are exposed to a plethora of infectious diseases that are not only harmful to the mother but to the fetus. The first and second trimester of pregnancy are considered the open wound, which requires a healthy immune response. Immune functions in pregnant women are associated with high risk of schizophrenia. And then you have your immune diseases like your viral and bacterial diseases that are the flu and pneumonia that will affect high risk of schizophrenia. There was a study done in 2007 by Smith, Lee, Garbett, Mimix, and Patterson. And in the study, they found that in pregnant women's second trimester, a respiratory infection increased the risk for schizophrenia in the fetus as well as in the flu infection. It was concluded that schizophrenia was caused by the mother's infection, and the theory was supported by a connection between elevated cytokines in maternal serum and schizophrenia in the fetus. I know your next question is, what is a cytokine? Cytokines are defined as a group of soluble peptides that play an important role in immune response as systemic mediators of the host response to infection. My proposed methods for this would be an experimental study to show the relationship between a pregnant woman's immune functions affecting the child developing schizophrenia. The independent variable in this study is how prenatal vitamins affect a pregnant woman's immune system. The dependent variable in effect is that a child beginning at age 12 will develop schizophrenia if the cytokine levels in the child's brain remain elevated. After gaining informed consent from the participants, which will all be volunteers, they'll be split into two groups. One, a control group of 20 women, will be given prenatal vitamins, and then there'll be an experimental group of 20 women who will not be given prenatal vitamins. And so the first test will be done on the fetus of the pregnant woman to determine the health and wellness of the fetus. The serum used in this test will have multiplex cytokine assay done to determine the amount of interleukin-8 in the bloodstream. The mother's amniotic fluid will also be tested to measure the levels of cytokine in the fetal brain. Elevated levels would mean a possible correlation with developmental of schizophrenia. It is proposed that children are given their first PET scan at age 12 because it can be first detected in adolescence. So a PET scan is a positron emission tomography, and It's an imaging test that can indicate how the tissue and neurotransmitters in the brain are functioning. So a PET scan will be able to detect schizophrenia in the brain earlier than any other imaging scans. And if willing, the child will first be given a PET scan at age 12, 18, and then 25. So first, the participant will be given a tracer. That's a radioactive drug to show what's happening in the brain. The tracers emit positrons that interact with neighboring electrons. And so those produce the image of the tracer uptake. Then patients with schizophrenia will show enhanced dopaminergic transmission leading to synaptic dysregulation, which will show positive symptoms of schizophrenia. If this study was done, I believe it would yield great results, but some limitations of this study would be having the resources and funds to access a PET scan, also keeping track of the children as they grow throughout life and making sure that they still want to participate in the study when they do become of age. Future directions for this study would be to assess if race was additive, also to see if age is an additive factor as well, because this age group was pretty broad, 20 to 40, to get a good variety of people, but future studies could focus on a smaller age group such as 20 to 25 or maybe 35 to 45 to see if age had anything to do with it. These are my references I used on my research proposal. I like to give credit where credit is due. If not, that's plagiarism, you know. But this is the end of my video. Thank you so much for watching, and everybody have a blessed day.